One of the most frequent questions I get is, what's it like to operate on someone after they've received preoperative chemo-immunotherapy? And I think that's because worldwide the most common approach is to operate first in a treatment-naive field, and everyone knows what that's like. And there have been reports of it being more technically difficult, or that the tissue planes are harder to dissect, and that this can be challenging. And so a lot of surgeons have trepidation about taking on that kind of patient or assigning them to that type of therapeutic strategy. So it's a real shift in the sort of paradigm of care. So that's a bit of a problem. Thoracic surgeons take on a lot of risk when they operate on lung cancer patients, and so they don't want to do anything that will further increase that risk, because when complications occur, it's bad news for patients. So that's the common perception, and the reality when we look at the data is that the administration of chemo-immunotherapy doesn't really change the complication profile of patients, at least as compared to chemotherapy alone. And we have a lot of data now saying that operating after chemotherapy is really no different in terms of the complication profile from upfront surgery. So a lot of it is about bringing that data to light and educating people about those pieces of data. But I think it's also sort of giving an anecdotal personal experience that we've operated on a lot of these patients over the last 6 years now. And so you grow accustomed to it, and it becomes a familiar thing to do. Certainly there are situations where the operation's more challenging, but for the most part it creates a window to a less invasive, less extensive operation, and from which patients can have really, really good outcomes. So on the whole, my perspective is there's a lot more to gain than there is to lose, and the survival outcomes just sort of speak for themselves. So as a community of surgeons, if our objective is to improve upon what we do in terms of offering cure, it really strikes me as the most rational and patient-oriented decision to make, is to adopt it as a way of treating for patients, who meet the criteria.